My name is Akin Abayomi. I'm the Commissioner for Health, Lagos State. So all our projects, including what's going on in the private sector, has resulted in about 3,500 medical facilities in Lagos State, of which there are about 400 in the public sector. Some of these projects are coming into immediate fruition, and some are long gestational projects that will come into existence over the next few years. What they're doing is they're creating the brand of Lagos State as the place to go to if you're seeking medical expertise, either in the public or in the private sector. The huge amount of medical infrastructure development going on in Lagos at this moment is also another stimulation to the economy of the state. And when you're building all these facilities, you need to equip them not just with medical equipment, but soft equipment, furnitures, you need artisans. But at the end of the day, when they're ready, you need medical personnel. And so what we've been doing in Lagos in collaboration with the private sector is to start to create the diversity of medical expertise that our citizens are looking for. Rather than flying to India or to Dubai or to South Africa or Europe, these facilities will start to provide the much needed services and medical expertise in Lagos State. So we're all aware of the current problem of brain drain. And one of the problems with brain drain is because we don't have this diversity of medical provision, specialist provision to our citizens. Our doctors are not challenged to develop themselves along these multi-specialist disciplinary areas, and are going abroad looking for opportunities to be exposed to some of these specialist areas. So when these facilities are completed, and some of them are coming on stream right now, we're finding that we are attracting Nigerians and other Africans in the diaspora to come back to Lagos to provide their expertise in these facilities. So we are experiencing brain drain, but we're also experiencing brain gain. And this has been a very deliberate strategic move of the Lagos State successive governments, all the way going back, as I said, to the health sector reform. And this is the ultimate objective of the health sector reform that His Excellency Bola Ahmed Tinubu had a vision for. And we've been carrying this all the way up to the present day. And we're seeing the realization of it right now as our colleagues that are in the diaspora that have attained very high levels of medical expertise are finding their way back to Lagos to work in these facilities, thereby contributing to our master plan of Lagos becoming the center of excellence. Now another, for health, another perfect example of the relationship between the private sector and the public sector was the way we managed COVID. Opening up to the private sector and allowing them to come in under, of course, strict regulation because it was a biosecurity threat. But between the public and the private sector, we were able to combine all our medical and logistical expertise and strategic thinking to understand COVID as it was manifesting in Lagos and be able to preempt it at every opportunity, thereby stopping it in its tracks at every opportunity and minimizing its impact throughout the 5 waves in Lagos, which allowed us to keep the Lagos State economy open. And by keeping the Lagos economy open, we're able to ensure the livelihoods of our citizens, but also allow our international economic partners and business partners to find Lagos a safe place to come to even during the COVID outbreak because of the low levels of COVID impact that we were able to ensure was happening in Lagos and protecting the major factors that were driving pandemics in other parts of the world. In terms of the insurance, the Lagos State Health Insurance, the impact is going to be huge because it's a contribution to the financing of health in Lagos State. Insurance is a key aspect of health financing. And so because we're going to make a social health insurance scheme now mandatory for all Lagosians as a result of the National Health Insurance Act, this is going to drive a major health insurance financing opportunity for us, making sure that we're achieving universal health care for all our citizens. In terms of Resolution 8B, we are finding now that our attention to maternal and child welfare and well-being, our mothers are giving birth to much bigger, healthier babies. They are attending antenatal clinic much more often than in the past, and exceeding the UNICEF threshold of antenatal visits for maternal care. So these are all sort of outcomes of the key strategies that we've been driving in the health sector, and we're beginning to realize the dividends of this years of strategic planning and implementation of a variety of projects across the state to ensure that Lagos has the dimensions and has the spectrum of healthcare delivery for its citizens, and to attract research and development and other patients from other states in Nigeria and across the sub-region, making us the destination for medical expertise.
Finally, sir, what are the future initiatives or plans your office would like to share in view of the Lagos State 30-year development plan?
So one of the key lessons that we learned during COVID was when there is a large demand for health services, like the surge of patients presenting with COVID infections, we realized that we had a very weak medical industrial economic base. So simple things like the manufacturing of masks and personal protective equipment, IV fluids, and simple pharmaceuticals were hard to come by during the COVID. And as a result of that, the economies of scale applied, and we found the cost of these reagents and consumables and general requirements for healthcare delivery were escalating. So we've started to conceptualize what we call the Lagos State Medical, Industrial, and Innovation Zone. We've earmarked an area of land that we will develop this concept, and the objective of this is to start to drive the indigenous production of medical industrial consumables and drive a research agenda which will lead to innovation. Local innovation, it's important for us, as we learned during COVID, that we understand how diseases affect our own citizens. So COVID, for example, had a different impact on Lagosians than it did on people living in Europe or America. If we had used a cut and paste strategy for the management of COVID, not only would we have wasted a lot of money, but we may have inadvertently caused more harm to some of our patients. So we were able to rapidly escalate a research and development plan during COVID, which led to several innovations that advised us on policy shifts and dynamics. So research and development and innovation are key to driving the bioeconomy in the medical sector. And for us to do that, we need to set up these high caliber research institutes that will be looking at indigenous diseases, looking at genomics. We're now in the era of genomic analysis or genetic analysis, and understanding how diseases affect populations based on their genetic makeup. It is only through these innovative initiatives that we're going to be able to create new treatments, new vaccines, and new products that are indigenous and developed through an innovation pipeline in Lagos and in Nigeria, which will certainly stimulate our economy and certainly improve the indigenous understanding of how disease entities affect our citizens and finding local solutions for local problems. So this innovation hub in the medical arena is going to really transform the landscape of medical understanding, medical research, medical innovation. And when people ask about why we're not able to manufacture vaccines in Africa, this is what you required as a first step in the pathway to developing the requisite number of human resources that understand how to carry out innovative research and how to translate the findings of this research into treatment modalities such as new drugs, vaccines, and therapeutics.